Hi, this is Dave Katz with Therapist Consultants, and I have a tip for you. You know, one of the biggest revenue centers in your practice, other than the counseling that you do, should be doing assessments with the patients. You see, every profession does assessments except the therapists. The therapists don't do many assessments. See, the medical doctor will do your blood lab, they'll do a urine specimen, a chiropractor will take x-rays, podiatrist will do work when they look at your feet. The optometrist will put the little wheels in front of you and check your vision. But the therapist doesn't do much for assessments. So here's what we suggest. We suggest you start doing assessments on almost all of your patients to see exactly where they stand. I talked to one of our clients. He said, "I'm so glad you told us to start doing assessments. I started doing them and they really help." I said, "Why is that?" He said, 2 reasons. One, they're so spot on. They help you understand the patient better. And he says, secondly, they uncover things that you should be talking about with the patient that you may not have talked about if you wouldn't have done the assessment. So assessments are very important. Now, the place to get assessments for you to use on your patients is from Pearson Clinical Assessments. It's online. Just go to Pearson, Pearson, Clinical Assessments, and you will see a whole list of assessments that you can do. Now, they have assessments for people in the A category, B category, and C category. The C category is generally the PhD or the PsyD or someone like that. Although if you are in the B category, which is usually the master's group, if you have any special training in statistics and things like that, or in judging people and doing assessments, you can probably move into that C category. The A category is for people like coaches and people like that want to do assessments on their people. Now, here's what we suggest. You do a general assessment on most of your patients. One that's good is the SCL90. The SCL90 is a test that is a long test. It's going to be about 180 questions. And then there are other tests that are shorter that you can use, like Beck Anxiety, Beck Depression, Quality of Life. We put those short ones together into a battery, and we call them a battery of tests. Now, what do you charge for that type of thing? Well, we suggest at the least you charge $100 plus the cost of the test. And you'll see Pearson will show you exactly how to do the test. They do the tests online. But I will tell you that one of the best things you can add to your practice to help your patients most and to boost your revenue a lot is do assessments on almost every patient that comes in. They'll be glad you did. You'll be glad you did. This is Dave Katz. Thanks for listening.